America is very good at naming problems. Studies get commissioned, reports get published, awareness gets raised. Japan, in a number of specific cases, skipped the awareness phase and went straight to building something. Not always with fanfare, not always with the kind of global press coverage you'd expect from solutions this good. Sometimes just quietly, in a prefecture most people outside Japan have never heard of, solving something that millions of people somewhere else are still just living with. I read about a city in Japan where the roads fix themselves, not with a crew, not with a work order filed 6 months earlier, not with orange cones sitting there for 3 weeks while nothing happens. The road just repairs itself at the material level because someone decided that was a problem worth actually solving. I sat with that for a while, not because the technology is so hard to understand, but because of what it implies about the gap between identifying a problem and deciding it deserves a real answer. These 15 kept coming back to me. Number 15, freshness. Sensing shelf labels. The average American grocery store throws away somewhere between 30 and 40% of its food before it ever reaches a customer, and the system responsible for tracking whether something is still good is essentially a date printed at a factory weeks before the product arrives on the shelf, which tells you when the manufacturer estimated the product would start declining under ideal storage conditions, not what the product is actually doing right now, in this specific store, in this specific refrigeration unit that may or may not be running at the correct temperature. Japan introduced a shelf label that solves this at the material level. Each tag contains a small biosensor strip that reacts to the volatile compounds food releases as it begins to degrade, and the label shifts color, green to yellow to red, across the 72 hours before printed expiry, responding to what the food is actually doing rather than to a date that was always just an educated guess. Stores using the system reduced food waste by around 34% in the first year, largely because staff could prioritize markdowns based on real label status rather than manually checking every item every shift. The labels cost about 2 yen each to produce and are composted with the packaging. America has known about food waste for 40 years. The response has mostly been better labeling guidelines and the occasional awareness campaign. The food keeps getting thrown away. Number 14. Underground pedestrian cooling corridors. The advice most American cities offer during heat events is to stay indoors, drink water, and check on elderly neighbors. It's reasonable advice for people whose lives allow them to follow it, which is not most people. People have jobs, people have errands. People live in cities specifically because there are things in them that require physically going somewhere. Japan's response in several dense urban districts has been to build underground pedestrian corridors beneath major commercial streets. Not subway tunnels, not shopping arcades, but dedicated walking infrastructure, climate-controlled year-round, connecting transit hubs to office buildings and residential blocks in a continuous shaded network. They have water refill stations every 200 meters, seating areas with cooling panels built into the backs of the benches, and air quality monitors near the entry points so you can check the particulate levels before deciding whether to go above or below ground. The construction cost per kilometer is distributed across the building owners whose properties connect to the network, who benefit from the increased foot traffic through their lower floors. Phoenix and Miami have both commissioned feasibility studies on similar infrastructure. Both studies were completed. Both were shelved. The heat continues. Number 13. Smart bins that sort waste at the point of disposal. Recycling contamination. The proportion of recyclable material that ends up in landfill because it was sorted incorrectly runs at around 18% in most American municipalities. And the solution the system offers for this is continued education, which has been the solution for 40 years and has not moved the number in any meaningful direction. Because the problem isn't that people don't know they're supposed to sort correctly. The problem is that correct sorting requires consistent correct behavior from millions of individuals across every single disposal event, which is a system design that will always produce a contamination rate. Japan addressed the actual failure point. Smart bins installed across several municipal areas identify the material being deposited through a combination of weight sensors, optical recognition, and a barcode reader covering the majority of packaged goods sold in the country, and open the correct compartment automatically. Items not in the database default to general waste and generate a flag for review. The contamination rate in pilot buildings dropped from 18% to under 3%. The bins don't require any behavioral change from residents beyond dropping waste in the general direction of the machine. That design principle, removing the dependency on sustained correct behavior, is the thing that makes it actually work, and it's also the thing that the American approach has consistently refused to apply. Number 12. Municipal noise. Mapping with real-time quiet zones. Continuous noise exposure is one of those urban quality-of-life factors that almost never shows up in policy conversations, despite a fairly clear body of evidence connecting it to elevated cortisol, disrupted sleep, and cardiovascular strain in people who live in loud cities. It's hard to see, hard to measure without dedicated infrastructure, and easy to treat as just part of city life, in the same way traffic and overcrowding are just part of city life. Japan built the infrastructure to measure it. A network of street-mounted acoustic sensors feeds into a municipal mapping system updated every 15 minutes, identifying blocks where noise has dropped below 55 decibels and designating them as active quiet zones on the city's public app. The designations connect to a courtesy notification system that reaches delivery companies, street vendors, and construction contractors operating in the mapped area, asking them to schedule louder activities during windows when the zone designation is inactive. Compliance runs around 78%. The zones are actually quieter, not just theoretically designated. People use the app to find quiet routes for phone calls, for eating outside, for walking with a headache. American cities have noise ordinances enforced by filing a complaint and waiting several business days for a response. Number 11. Hospital arrival. Routing that starts before you leave home. If you've ever arrived at a hospital for an appointment and spent the first 15 minutes figuring out which of the 17 waiting areas is the right one, before realizing you were supposed to check in at a desk on a different floor, you've experienced a specific kind of institutional indifference to patient stress that has always been treated as just how hospitals work, rather than as a design problem with an available solution. Several Japanese prefectures have implemented a pre-arrival routing system where entering your appointment details into the hospital app, returns a timed departure notification based on current transit conditions, a pre-checked-in status that activates when you enter the building, and navigation to the specific waiting area for your appointment type. If an earlier appointment runs long, the system adjusts your recommended arrival time and notifies you before you've left home, which reduces waiting room crowding and measurably reduces patient anxiety scores recorded at check-in. The technology involved is not exotic. It's an appointment system connected to a mapping tool and a transit API. What's rarer than the technology is the organizational willingness to treat a patient's time and stress level as a design problem in the first place. Number 10. Food allergy detection wands in restaurants. Around 200,000 Americans are hospitalized for food allergy reactions every year, and the number has been rising consistently for 2 decades. And the system for preventing this at the point of consumption is asking a server, who asks the kitchen, who may or may not check, and trusting that the answer you receive reflects how thorough that particular chain was on the particular night you happen to ask. It is not a system designed for the person with the allergy. It's a system designed around the restaurant's existing workflow, with the allergy question inserted into it. Japan developed a handheld scanner available at the entry of participating restaurants that detects the 9 major allergens at concentrations above the threshold. Affecting most people with standard allergies, using spectrometry technology originally developed for food safety inspection in manufacturing, and miniaturized through a joint project between a food tech company in Osaka and the National Health Ministry. It doesn't replace kitchen disclosure. Restaurants using it are required to train staff on its limitations, but it provides a secondary check that has caught cross-contamination events in kitchens where the staff genuinely believe the dish was clean. The scanner exists because someone decided that 200,000 hospitalizations a year was a number that warranted building a tool, rather than a number that warranted more thorough server training. Number 9. Public rest pods instead of benches. American public seating is one of the more quietly revealing things about American public space. The design of a bench in most American cities reflects a specific set of priorities, and comfort is not near the top of them. Center armrests that prevent lying down, hard surfaces that become uncomfortable after about 10 minutes, placement that prioritizes visual order over actual usefulness. The bench exists to fulfill the bureaucratic requirement of providing public seating. It's not really there for the person who needs to sit. Japan has been replacing a portion of its public seating in transit hubs and commercial districts with individual enclosed rest pods, a reclining seat inside a sound-dampening shell, a small ventilation fan, a 15-minute timer that gently vibrates when the session ends. They're free, open to anyone, and designed around the physiological value of a brief rest at a moment when your body needs it. Occupancy data from the deployed pods shows the majority of users are workers on lunch breaks, parents with small children, and elderly people resting during long transit journeys. Not the population that American bench designers were managing for when they installed the center armrests. Number 8. Workplace sleep debt tracking. As an occupational health metric, Japan has its own complicated relationship with overwork. Karoshi, death from overwork, is a legally recognized cause of death with government tracking and compensation frameworks. So it's not presenting itself as a solved case on labor culture. But the specific response to sleep deprivation in the workplace is worth paying attention to because it addresses the problem structurally rather than individually, which is the distinction that makes it actually work. Several Japanese companies, following a Ministry of Health recommendation, now require employees to wear a wristband sleep tracker during work weeks and submit anonymized weekly sleep data to an occupational health dashboard. Individuals whose cumulative sleep debt exceeds the threshold associated with impaired cognitive function, roughly the equivalent of a 0.05 blood alcohol level, receive an automatic scheduling adjustment that clears their afternoon of non-essential meetings and adds a 20-minute rest allocation. Managers whose team average exceeds the threshold for 2 consecutive weeks go into a workload review with their department head. The system responds to the data by adjusting the environment. It doesn't penalize anyone for sleeping badly. The American version is a wellness program that sends emails about sleep hygiene, which the employee reads at 11 p.m. While unable to sleep because of the workload, the wellness program has no authority to address. Number 7. Community grief. Centers as municipal infrastructure. Grief counseling in America is a clinical service that costs between $100 and $300 per session without insurance, and grief support groups exist inconsistently and are genuinely difficult to find if you don't already know someone who went. The system is built on the assumption that grief is a personal medical event requiring a professional response, which means access to support is determined primarily by whether you can afford it and whether you happen to know it exists. Japan's municipal grief centers in several cities grew from informal Buddhist community support structures that existed for decades and were formalized after research showing that structured peer grief support reduced the incidence of complicated grief disorder by around 40% compared to populations without access to it. They're not clinical settings. They're neighborhood spaces with trained volunteers, scheduled group sessions for different types of loss, and drop-in hours where you can sit with someone who has experienced something similar without it constituting therapy or requiring an appointment or costing money. The Japanese model is a building in your neighborhood with the lights on. America has awareness that grief is a public health issue and a system that treats it as a private one. Number 6. Self-repairing road surfaces. America's deferred road maintenance backlog is estimated at over $400 billion, which is partly a funding problem and partly a material science problem that has been available to solve for several years. Nagoya Prefecture has been laying an asphalt mixture containing microcapsules of a petroleum-based binding agent distributed through the road surface, which rupture when the surface cracks under thermal expansion or vehicle load, releasing the binding agent into the crack where it hardens on contact with air and seals the fracture before water can enter and widen it. The process is entirely passive, no sensors, no municipal response required, no crew. The road surface costs about 18% more to lay than standard asphalt, but the reduction in maintenance frequency reduces the total cost of ownership by around 30% over 10 years, compared to roads requiring conventional crack repair. Several American university engineering departments have studied the Nagoya formulation. The roads remain broken. This is not a technology problem. It is a procurement problem, a budget cycle problem, and a political problem about whether the upfront cost of better materials can survive a 4-year election cycle. The road doesn't care about any of that. It just keeps cracking. Number 5. Personalized hydration stations. Japan's summer heat and outdoor labor culture drove the development of dispensing stations in transit hubs and outdoor commercial areas, offering still water, sparkling water, and a hot weather electrolyte solution at no cost during months when the heat index exceeds a municipal threshold. In 2021, the stations added a function where tapping an NFC card or phone returns a dispensing recommendation based on a brief health profile. Whether you have conditions like hypertension or kidney issues that would affect the appropriate electrolyte concentration for you. The recommendation takes 4 seconds. An estimated 340,000 people use the network on peak summer days, and heat-related emergency calls in covered districts dropped by 22% in the first summer of full operation. America has water fountains that work intermittently and sports drink vending machines that charge $3.50. The gap between those two things is not a gap in available technology or available funding. It's a gap in whether free public hydration infrastructure is treated as something a city owes its residents or something residents are expected to purchase. Number 4. Apartment air quality ratings. As mandatory rental disclosure. When you rent an apartment in America, the law requires the landlord to tell you about lead paint in pre-1978 buildings. It requires nothing about the air quality of the unit, regardless of age, building materials, what the previous tenant was doing in there, or how well the ventilation system works, which is information that has measurable long-term effects on the respiratory health of the person who is about to spend several years sleeping and breathing in that space. Japan's mandatory air quality rating system in participating municipalities requires landlords to disclose a standardized score covering particulate matter levels, volatile organic compound concentrations, radon levels, and ventilation performance before the lease is signed. Poor-rated units rent for measurably less and sit vacant longer, giving landlords a financial incentive to improve ventilation and address emission sources without requiring enforcement. The system was introduced after research connecting indoor air quality to respiratory health outcomes in dense urban housing made the issue difficult to ignore from a public health standpoint. America has the same research. It has not yet made the issue difficult to ignore from a legal standpoint. Number 3. Crowd density routing sent to your phone before you arrive. Japan's public infrastructure in several cities sends crowd density alerts to opted-in users before they reach a destination, using anonymized mobile signal data to estimate how many people are in any given block, train platform, or public space, and routes users toward lower density alternatives when the area they're heading to is above a comfort threshold. The data is anonymized before processing. The routing is a recommendation, not a restriction. Nobody is being turned away from anywhere. The effect is a measurable redistribution of foot traffic away from peak congestion points during the hours when they're most congested, which solves the specific misery of committing to a journey and arriving somewhere completely packed. Disneyland uses a version of this internally. The general principle of routing people around public urban congestion in real time, using data that phone networks already have, requiring no new infrastructure, hasn't been implemented at a city level in America, despite being technically straightforward, and despite every large American city having a congestion problem that costs residents measurable time every single day. Number 2. Structural emotion. Monitoring in school environments. Several Japanese school districts installed a biometric feedback system where students sit on chair pads containing pressure and heart rate sensors that feed aggregate, anonymized stress data to a dashboard accessible to teachers, showing the room's general emotional state as a group without identifying any individual. The teacher sees a room-level stress reading, low, moderate, elevated, updated every few minutes, and uses it as one input when deciding whether to continue a lesson, pause, or change the activity. The system came from research showing that classroom stress during standardized test preparation was consistently elevated in ways teachers couldn't detect from behavior alone, because Japanese classroom culture trained students to mask distress. Individual data is never accessible to anyone. American schools are managing a documented student mental health crisis and have responded primarily with counselor hiring that remains far below recommended ratios. The idea that the classroom environment itself could be monitored and adjusted in real time, without identifying individuals, without surveillance, just as a room-level temperature check for human stress, that hasn't entered the conversation yet. I'm not entirely sure why. Number 1. Airport sleep chambers that rebook your flight if you oversleep. 3 Japanese international airports have sleep chambers where you book a rest period, and if you fall asleep and fail to wake for your departure despite standard alarms, the chamber's system contacts the airline, moves you to the next available flight, notifies anyone waiting at the destination, and charges the rebooking fee to the payment method on file. The service costs around $28 for 4 hours and includes shower access, a meal credit, and a wake protocol that escalates through vibration, light, sound, and finally a staff knock if nothing else has worked. The rebooking function has been used around 200 times since 2021, which is a small number relative to total bookings, but represents 200 situations where someone exhausted enough to sleep through an international departure was caught by a system designed specifically for that failure rather than left to spend 4 hours on the phone with customer service. American airports have seating designed to prevent sleep and a customer service system designed to make rebooking as time-consuming as possible. Japan looked at the same situation and decided that an exhausted traveler missing a flight was a problem the airport could take some responsibility for. That's a small shift in how you frame the problem. It produces a completely different outcome. What I keep coming back to with all 15 of these is that none of them required inventing something new. The sensors exist, the materials exist, the data already exists. What's different is the decision that a daily frustration is worth a real structural response rather than an awareness campaign or a lifestyle recommendation. America treats a lot of these things as personal problems: your road, your food, your sleep, your stress. Japan, in these specific cases, treated them as design problems, which is a different framing, and it produces different results. Not always. Japan has its own list of things it handles badly and hasn't fixed. But on these 15, the gap between what exists there and what exists here is not a gap in knowledge or resources. It's a gap in what gets treated as worth solving properly. Subscribe if you want to keep finding things that work, wherever they happen to be working. See you in the next one.